David Brenner has spent years developing an ultraviolet or UV lighting system that can kill viruses, including SARS-CoV-2.
UV light has been used to kill viruses for a very long time, and it's 100 years since we knew that UV light kills viruses. And certainly in the past few decades, people have been using UV light a lot to kill viruses. In hospitals, for example, it's used in operating rooms overnight. So when the surgery is finished, everybody leaves, and then you can use conventional germicidal UV light to sterilize that room.
Ultraviolet light is on the same spectrum as visible light, but has a slightly shorter wavelength that cannot be seen by the human eye. It can be broken down into 3 groups: UVA, B, and C. UVC is the shortest and most energetic, often called germicidal UV for its sterilization properties.
Conventional germicidal UV light is really good at killing bacteria and viruses, but you can't use UV light directly in situations where people are around because it's a health hazard. It has issues with the skin and issues with the eye. So what we started to think about is there a type of UV light that we might be able to use which actually still kills bacteria and viruses, but doesn't have the safety hazards of conventional germicidal UV light. And that's where the far UVC idea came from.
Conventional germicidal UV light has a wavelength of 254 nanometers, but is harmful to humans. Far UVC light has a shorter wavelength of 222 nanometers, which they believe is a lot safer.
So we've been working for a couple of years to look and see, does our technology work for killing influenza virus in the air? And indeed it does. So when the COVID-19 crisis came along, we realized pretty quickly that could be very well the same story, that we're looking to kill the COVID-19 viruses in the air while still being safe for human exposure.
Far UVC kills viruses by warping the structure of its genetic material, preventing replication. Professor Brenner and his team have studied the technology with 2 coronaviruses that cause the common cold. They found that 16 minutes of far UVC light kills 99% of coronavirus particles in the air. And they're confident it doesn't harm humans, which is supported by several long-term studies.
Essentially, on the very surface of our skin and on the very surface of our eyes is a layer of cells which are not living cells. So the far UVC light, as it's impinging on the skin, simply gets absorbed in those dead cells, and so can't reach the living cells in the top layer of our skin. On the other hand, bacteria and viruses are really, really, really small, and much smaller than human cells and groups of human cells. So the far UVC light can certainly penetrate them and kill them. And that's the basic science of why it would work. I think where our technology would be most applicable is simply where you have groups of people together. These far UVC lights will be part of the same structure as those visible lights, or there'll be a separate light hanging next to those lights with a gentle purple color, really to tell people that the lights are on and to reassure people that it's working. So many people would like these lights in all sorts of different settings, in offices, in hospitals, in schools, in restaurants, in theatres and airplanes. As we start to come closer together, we need all the weapons we can get to limit the transmission of the COVID-19 virus.